The subcommittee will come to order. Welcome to the Labor HHS Education Appropriations Subcommittee for our Member Day hearing. As the largest non-defense appropriations bill, this subcommittee allocates approximately 1/3 of annual non-defense discretionary spending. The programs in this bill equip our nation to deal with public health emergencies. They fund life-saving biomedical research. They level the playing field for low-income children looking to get a good education. They help Americans get the skills they need to find a job as the country recovers from simultaneous public health and economic crises. These programs directly impact the lives of Americans across our country, especially children, families, and seniors. I am pleased the Biden-Harris administration is proposing significant investments in these critical areas in fiscal year 2022. The full budget will be released next week on May 27th. However, we know the president will be proposing historic investments in education, health and human services, and labor programs funded by this subcommittee. Department of Education, $103 billion, an increase of nearly $30 billion above the 2021 level. It's a 40% increase. The Department of Health and Human Services, $119 billion, an increase of $22 billion over the 2021 level. That's a 23% increase. And the Department of Labor, $14 billion, an increase of $1.7 billion over 2021, and a 13% increase. As we draft a new bill for fiscal year 2022, it is important to hear from our colleagues about their top priorities. I would like to remind members that you will have 5 minutes for your oral testimony. Your full written testimony will be entered into the hearing record. And now, without further ado, I would like to recognize our good colleague from Texas, Congresswoman Veronica Escobar, for 5 minutes.
Thank you so much, Chair DeLauro and Ranking Member Cole, for this chance to discuss priorities I have before your subcommittee. I'm so grateful to my community for their robust engagement in our community project funding process. It was a wonderful opportunity to learn even more from my community's leaders and to better understand the needs of our region. I'm proud to have submitted 2 of these projects to your subcommittee for consideration. The first project I'd like to discuss is University Medical Center's robotics expansion. The funding for this project would be used to purchase a Da Vinci single port robot for the University Medical Center at El Paso. As the only level 1 trauma center in West Texas and as a facility that serves much of the uninsured population in El Paso, UMC is critical to the health infrastructure of the entire Paso del Norte region. As a result, acquiring the single port robot will allow UMC to improve their minimally invasive service offerings and expand their high-level medical care for everyone in El Paso, including the uninsured. It will also give the Texas Tech Health Sciences Center residents the chance to train and gain valuable clinical skills that will strengthen our future workforce. Finally, this robot will become a valuable tool in the treatment of urological cancer, a service which is currently not available in the El Paso area. The second project I'd like to bring to your attention is the La Fe Federally Qualified Health Center, FQHC, technology upgrade. Like many FQHCs in El Paso and across the country, La Fe serves incredibly vulnerable populations like the uninsured, immigrants, and more. La Fe also works in economically disadvantaged communities known as colonias, which are unincorporated areas sometimes referred to as the Forgotten America. While the work La Fe is doing is vital to our community, their technological infrastructure is in need of a complete overhaul. The funding requested for this project would do just that by interconnecting their many health services, upgrading telecommunications equipment, increasing their server capacity, and more. This overhaul would allow La Fe to act as a more effective healthcare provider and ultimately benefit those who are most vulnerable in El Paso. I'd like to now move on to 2 appropriation report language requests I submitted to the committee for consideration. The first is language urging HHS to fund the U.S.-Mexico Border Health Commission at $2 million for fiscal year 2022. The Commission is an essential organization that focuses exclusively on unique health needs and issues of southern border communities. However, during the previous administration, funding for the commission was minimal, dropping as low as $800,000 for one fiscal year. This led to the commission being understaffed at a point when their expertise was needed the most. If the border region is going to successfully put the pandemic in the rearview mirror, we need HHS to increase funding for the commission so it can work to its full potential. This leads me to my next request. Since the start of the pandemic, I've been sounding the alarm about the need for a binational COVID-19 strategy. This is not a partisan issue, as I made numerous attempts to urge the Trump administration to develop a binational strategy, and I've continued to advocate for it with the Biden administration. However, we've still not seen any action to follow through on these requests. Just yesterday, we heard President Biden announce that we will be exporting 20 million more doses of vaccine to other countries. I commend the president for this action, as getting shots in the arms of as many people as possible at a global scale is important. But we've still not heard anything on whether these vaccines will be used to vaccinate Mexican border cities. Just a few weeks ago, Ciudad Juarez, which is right next to my district, had to go into lockdown for a weekend because of an increase in COVID-19 cases. The reality is that border communities like mine will not truly reach herd immunity until our Mexican sister cities also begin seeing increased vaccination rates. My final report language request would urge the U.S. section members of the Commission to engage with their Mexican counterparts to develop a binational vaccination plan so communities on both sides can return to normal. Finally, I want to emphasize with this subcommittee, as I have with other appropriation subcommittees, it is essential that you include mechanisms within your bill to guarantee that federal funding makes it to its designated recipient. In my state of Texas, Governor Greg Abbott has stood in the way of critical COVID and migrant relief funds. We need to make sure that that doesn't happen with future appropriations bills, and I urge the subcommittee to take this into consideration. Thank you so much for the opportunity to testify before you today. I look forward to collaborating with the subcommittee as you continue to draft the final appropriations bill, and I yield back.
Thank you. I want to thank the Congresswoman, and let me ask my colleagues, and I don't know what order they're on, but Congressman Pocan, Klein, and Congresswoman Lucille Roybal Allard, if anyone has any questions for Congresswoman Escobar. Okay, let me just very quickly thank you very much for coming and talking about these programs. And I think one of the things that you said at the end is about we should pursue this maybe offline, is that the holding up of funds that you mentioned, since if the funds have been appropriated, these are funds that should not be held up to move forward. And obviously, we will be giving great consideration to the projects that you have talked about, the technological, the upgrade, and on the robotics expansion there. And I think we need to look at the whole issue of the vaccination program, and with regard to the border, and that also includes looking at what happens with unaccompanied children, et cetera. These are all, I think, critically important issues. And I want to thank the gentlelady for being here today and letting us know what are the critically important issues to you and to your community. And please know they'll be given every consideration. So thank you very much.
Thank you,
again,
Chair.
Are there any questions from my colleagues? Okay, hearing none. Thank you. Thank you very much.
Thanks to everyone.
Thank you. I believe next on our list is Representative Fitzpatrick from Pennsylvania. Representative Fitzpatrick.
Chair DeLario, Ranking Member Cole, thank you for convening this Member Day hearing. And I'd like to speak about my top HHS subcommittee requests. First, medical research is one of the best investments our country can make to ensure that lives are saved. And for every dollar we spend in research, we save up to $26 in treatment costs. For every dollar that goes towards the National Institutes for Health, $8 from the private sector are put towards research. NIH has provided funding and support for some of the world's best and most important medical research. And the NIH has, since beginning, been the best hope for finding cures, improving treatments, and gaining better understanding of the diseases and the conditions that affect millions of Americans. Madam Chairwoman and Ranking Member, pediatric cancer research is one of the most important fields of research conducted at NIH. Children are our future, and this research funding can save children's lives for sure. This year, I led a bipartisan letter requesting that funding for pediatric cancer research be increased by no less than $50 million in fiscal year 2022. I would also like to highlight my bill, HR 2210, the Fairness to Kids with Cancer Act, which would ensure federal funds for pediatric cancer research match the same percentage of the number of American citizens under the age of 18 as part of the general population. I hope that those on this committee will consider co-sponsoring this important legislation. It's extremely bipartisan, equally bipartisan, in fact. Another request, Madam Chairwoman, Ranking Member, that I would like to bring to your attention is for the National Institute of Diabetes and Digestive and Kidney Diseases under the NIH. The Institute conducts needed research that benefit millions of Americans, like children and adults with both type 1 and type 2 diabetes. I've heard countless constituents tell me about their struggles with diabetes and kidney disease. The Institute can help the over 34 million diabetic Americans. Those with diabetes have been at significantly higher risk of becoming hospitalized and dying due to COVID-19, as we all know. The Institute helps millions, and I joined a letter written by Congresswoman DeGette and Congressman Reed and signed by 105 of my colleagues requesting the total funding of the Institute at $2.29 billion for fiscal year 2022. And as the co-chair of the ALS caucus, I've learned and been active in trying to advocate for those suffering from this debilitating disease. Every year, an estimated 5,000 Americans are diagnosed with ALS. Those newly diagnosed can only expect to live for 2 to 5 years. We still do not know the causes of ALS, which is why I strongly support the maximum funding possible for ALS research across NIH and DoD's ALS research program. We must learn more about this disease in order to help those who are suffering from it. Mental health resources are more important now than ever, given the pandemic and the spike in substance use in the past year. Just because the COVID-19 pandemic started does not mean that the opioid epidemic ended. In fact, 81,000 lives were lost between May of 2019 and May of 2020 due to a drug overdose. That is why I support the highest possible funding for the Substance Abuse and Mental Health Services Administration and co-led a letter with Congresswoman Wild and signed by 51 of our colleagues. They play a critical role. SAMHSA plays a critical role in leading the substance use disorder efforts at the national level. Finally, those living with paralysis often struggle to find the best ways to live with their condition. This year I joined Congressman Langevin in leading a letter requesting $9.7 million for the Paralysis Resource Center and signed by 16 of our colleagues. The PRC provides invaluable resources to those living with paralysis so that they can achieve independent, high-quality lives. The programs at the PRC give those with paralysis the best chance for a better life. I appreciate your consideration to each of these requests that I've submitted and spoken about today. Thank you, Madam Chairwoman, Ranking Member, and I yield back the balance of my time.
Thank you very, very much for your testimony. Let me yield to my colleagues who may have a question. If so, just raise your hand, I guess, in the chat. So what I know now is Congressman Pocan, Congressman Klein, and Congresswoman Roybal Allard. And I think Congressman Harder is there as well to see if any of you have any questions. If not, I would like to just say to Congressman Fitzpatrick that In the 2020 omnibus appropriations bill, we included an additional $50 million for the Childhood Cancer Data Initiative and an additional $30 million for the Childhood Cancer STAR Act. And in the 2021 appropriations bill in the omnibus contained these investments as well. So just to demonstrate there was a strong issue on a bipartisan basis to address these issues. And I think you made an important statement by talking about the value of biomedical research, which is, not for saving one life, but thousands and thousands of lives. And I also let you know that I believe it's tomorrow, is that when we have public witnesses, that the ALS will be represented, the community will be represented tomorrow to speak about increased funding for and efforts for ALS. So let me, thank you for your testimony and much appreciated. Thank you. Take care. And obviously we'll take all this into consideration. Thank you for being here.
Thank you, Madam Chairwoman.
Next, we have Congressman Brian Higgins of Massachusetts. Congressman Higgins, the floor is yours.
Higgins from New York.
Higgins is from New York. That's right. Oh my God. Lynch.
We love Massachusetts.
Lynch is from Massachusetts. Okay, there we go.
That's okay. Thank you, Madam Chair, for affording me the opportunity to speak today. The COVID-19 pandemic has had a substantial impact on the cancer community. Fear of the virus has led to a delay of screening and treatment for tens of thousands of patients over the next decade. The National Cancer Institute estimates that there will be an additional 10,000 deaths from breast and colorectal cancer alone due to missed or delayed screenings that could have caught the disease early. Cancer research has also been significantly disrupted by the pandemic. As cancer cases and deaths increase as an indirect consequence of COVID, there will be additional pressure on cancer research community to find new ways to prevent, treat, and cure cancer. Congress must continue to increase funding to the National Cancer Institute to regain the ground that's been lost by the interruption, and in some cases, termination of vital cancer research over the past year, like that being done at Roswell Park Comprehensive Cancer Center in my district in Buffalo, New York. To meet these goals, this subcommittee should commit at least $7.6 billion in overall funding to the National Cancer Institute for fiscal year 2022. This pandemic has thrown existing racial disparities in all aspects of our healthcare system into sharp relief. The situation is no different in cancer care. Although the gap in cancer mortality between Black and white Americans narrowed over the past decade, Black Americans still have the highest death rate and lowest survival rate of any racial or ethnic group in most types of cancer. The delays in screening and treatment caused by COVID-19 will only serve to widen those gaps once again. One area in which these disparities persist is lung cancer. According to the National Cancer Institute, between 2010 and 2015, only 6% of all adults for whom lung cancer screening is recommended underwent this simple procedure. Screening rates vary widely by race. While the screening rates for Black Americans is 6.8%, only 0.7% of eligible Hispanics received screening. And while lung cancer death rates have declined dramatically in the last few decades, it remains the #1 cause of cancer deaths in America. But before a doctor can perform a lung cancer screening CT, their office must have access to a lung cancer screening registry. Currently, there is only one CMS-approved lung cancer screening registry, and that is not acceptable. In order to increase screening rates, CMS should immediately make targeted investments to increase the number of free and low-cost lung cancer screening registries. I urge this committee to prioritize additional funding for registries so that all Americans have access to screening in your appropriation bill this year. I thank you, Madam Chair, and I yield back.
And thanks, gentlemen, and ask if my colleagues have any questions for the congressman from New York. And with that, let me just say, as someone who is a survivor of cancer and of understanding the need for the research and registries, it's a critically important issue. And I thank you for that. And you can be sure, I think you're requesting language, and we'll speak further to you with regard to resources that you might be interested in. But thank you very, very much for your testimony today. Much appreciated.
Thank you, Madam Chair.
Thank you. We have next Congressman Josh Harder, and Congressman Harder is a member of the Labor HHS subcommittee. So it's a pleasure to recognize you today, Congressman Harder.
Thank you so much, Chair DeLauro, for the opportunity to speak before the subcommittee today. I wanted to take a moment and also thank the rest of the members for welcoming me, as you said, to the LHHS subcommittee of this Congress. It's been an incredible opportunity to be a part of the critical work the Appropriations Committee does every year. I've spent the last months on a listening tour across our district, and healthcare is one of the top concerns that I've heard again and again from just about everybody. There are two specific problems that I'd like to bring to the committee's attention today and propose some solutions that I think could help address them. The first issue is access to care. To give you a sense of how bad it is in our region, when our ICU bed capacity was at 0% because of COVID in the worst months of the virus, it wasn't because we didn't have enough beds, it's because we didn't have enough doctors, enough nurses. People are waiting months to see specialists. And when they do finally get an appointment, they have to drive hours to their appointment in San Francisco or Sacramento or somewhere else. If we truly believe in healthcare access, we need to include diverse agricultural communities like mine. The second issue is specifically about access to mental health services. I won't sugarcoat it. We are in a crisis situation in the Central Valley. It is tearing up our families. It all comes back to access to care again. My district has almost half of the amount of mental health providers as the rest of the state per capita. And to paint a picture of where we are in California, the single largest mental health provider across our state is the LA County Jail. Our system is terribly broken, and we need to work to fix it fast. So I'm here to advocate for a couple solutions that I see as common sense and impactful opportunities to address these challenges. I'm not proposing a pie in the sky idea. This is not some sort of Hail Mary fix. We're talking about a few key things that we can get done this year to make physical and mental health care accessible for our community. First, let's fix the Public Service Loan Forgiveness Program. It was created 15 years ago to encourage doctors to serve communities just like mine. It says that if you work at a nonprofit hospital for 10 years in an area with a shortage of doctors like the California Central Valley, we'll forgive your student loans. That's it. And it makes a lot of sense. But today, it doesn't happen in California or Texas. Because of an accidental oversight in the program's language, doctors in my community are not eligible for student loan forgiveness. When an average medical student has $250,000 in debt, that's a major deterrent to practicing in the communities where we need them most. Just fixing this one oversight would bring 10,000 new doctors to underserved areas like mine over the next 5 years. Second, we have to work to make sure practitioners are getting into our underserved communities of color. We need to fund programs like the Community Health Outreach Worker Program. In the Valley, we call these incredible people the promotores. They're Spanish-speaking professionals who use their community knowledge to connect families to the services that they need. I'm proposing an effort to effectively double the number of full-time staff in the promotores program. It would allow this highly successful program to expand their partnerships with local schools so we help kids and their parents early on before a one-time issue becomes a lifelong health battle. We know this model works. Now we need to invest to scale it up. To tackle mental health access, I have two projects that would make a world of difference in our community. The first is supporting a nonprofit in our district, the First Behavioral Health Urgent Care Center, which serves everyone who walks through their doors regardless of if they can pay. This project will help hire new bilingual staff, including a behavioral health clinician, and kickstart new programming to fight the stigma attached to mental health. This funding will help the nonprofit serve almost 1,000 new folks every year, largely from our underserved Hispanic and youth populations. The second project tackles the joint emergencies of mental health and homelessness. The Mental Health Residential Facilities Bed Shortage Regional Partnership would bring together our local counties to address the significant shortage of mental health treatment beds for anyone experiencing a mental health crisis or homelessness. We'll put together a needs assessment program, and if we find the amount of need our leaders expect, we will work to establish a new residential mental health facility in the Central Valley. There's no silver bullet to solving our healthcare emergency overnight, but I strongly believe that these four programs would be a huge step forward for our community. Thank you so much to Chair DeLauro and her staff for working with me on these initiatives. I stand ready to do everything in my power to make them happen. Thank you for your attention. I yield back the balance of my time.
Thank you so much, Congressman Harder. Thank you for your thoughtful and your clarity on the issues that are out there and your suggested solutions. What is critically important, and we do it in other areas, so we have to take a look at that, the student loan forgiveness issue very, very carefully so that we can increase providers and the mental health issues and the tie to homelessness are very, very clear. In a prior hearing last week, we dealt with mental health issues, homelessness, all of which doubled in law enforcement efforts. And one of the conclusions at that hearing was, how do we bifurcate what are law enforcement issues versus those that require a social service response rather than a law enforcement response. So I thank you for just laying out, as I said, with such clarity, the issues and recommended solutions, and look forward to working with you on these efforts. So thanks very, very much. I don't know if my colleagues who are on the subcommittee have any questions for Congressman Harder. Hearing none, thanks very, very much for your time. Appreciate it. Thank you. If I now would like to recognize Congressman Rose from Tennessee, and Congressman, we're looking forward to your testimony.
Thank you, Chairman DeLauro and Ranking Member Cole and members of the subcommittee. Thank you for this opportunity to speak today about several key priorities for the 6th District of Tennessee. It is an honor to be here, and I appreciate the hard work that each of you are doing. Access to quality emergency health care in rural areas is critical to ensuring that when someone suffers a life-threatening emergency, they are able to be seen in an emergency room within minutes instead of hours. Unfortunately, our country is currently in the midst of a rural hospital closure epidemic. According to a December 2020 GAO report, over 100 rural hospitals have closed since 2013. And I am sad to report to this subcommittee that my district, the 6th District of Tennessee, has not escaped this rural healthcare disaster, as 2 hospitals serving the 19 rural counties that I represent and the rural populations have recently closed. It is hard for me to put into words the emotional gut punch a rural hospital closure has on a community. However, the scariest part, the part that keeps me up at night, is fearing that I will wake up in the morning and find out that one of my constituents, one of my neighbors, did not survive the long journey to the nearest emergency room. Unfortunately, this nightmare has become our reality. In 2019, a constituent of mine, Jamestown resident Maria Ramirez, became unconscious and in desperate need of acute medical care. Her son, John Ramirez, could not take her to the closest hospital, Jamestown Regional Medical Center. Why? Because of its closure in May of 2019. Instead, his only option was to take his mother to her primary care clinic. Once there, the medical team did the very best they could using the medical tools and services readily available. After stabilizing Mrs. Ramirez, she was taken via ambulance on the long, arduous journey to the next closest hospital, which happens to be more than 38 miles away, almost an hour drive in Crossville, Tennessee. Unfortunately, the hospital in Crossville was full, forcing her then to be airlifted to the hospital in Cookeville, where she tragically lost her life. The closure of rural hospitals like Jamestown Regional Medical Center results in significant loss of life and great suffering. In Mrs. Ramirez's case, had the hospital been open, more could have been done during the critical onset of her medical emergency. Today, I come before you with a solution to this epidemic, a solution that cannot be accomplished without your assistance. The Jamestown community has been urgently trying to set up an emergency healthcare facility. This town has partnered with the University of Tennessee Medical Center in Knoxville to renovate an existing building to develop a freestanding emergency room and primary care clinic in Jamestown. I was proud to submit a community project funding request to this subcommittee on behalf of UT Medical Center to bring this freestanding emergency room and primary care clinic to fruition. The community project funding request I submitted would be used for state-of-the-art equipment, revitalization, and an additional 410 square feet of new space. This is about improving a critically deficient quality of life issue for the people of this community and the surrounding area. Today, I humbly ask for your support of this life-saving project. Thank you again for the opportunity to testify, and I look forward to working with the subcommittee on these important issues. Thank you.
Thank you so much, and thank you for your eloquent comments about the story of Mrs. Ramirez. And it really is a tragedy when the resources could be there and they're not there, and then someone loses their life. And it shouldn't be the case in the United States of America. We certainly are a land of plenty, and in this in abundance. I look forward to working with you on the whole issue of rural hospitals and the kind of efforts we can make in this space. We want to make sure that particularly what this virus has exposed to all of us is there are areas that we knew where we had shortfalls before, but has focused more attention and exposed the disparities. And I think that we can look to having a potential opportunity for really looking to see how we build that architecture for the future so that these kinds of things don't happen, and all of our communities have the necessary resources that they need in order to save lives. So I thank you very, very much and look forward to working with you. Thank you.
Thank you.
Thank you. I believe we have Congresswoman Sheila Jackson Lee. No, I guess we're going to Congressman Case. Is that correct here? Congressman Case? Okay. Well, let me ask if Congresswoman Sheila Jackson Lee is there. No. Representative Hagedorn, Minnesota.
Madam Chair, can you hear me?
I can.
All right. Am I up? That'd be great.
Yeah.
So thank you, Madam Chair. I appreciate the opportunity, and Ranking Member Cole as well. It's a pleasure to be with you.
Mm-hmm.
Very important subject, and I just want to tell you offhand the work that the subcommittee and your overall committee has done in the past in order to promote research, the basic research dollars for important diseases that we need to eradicate: cancers, Alzheimer's, Parkinson's, Lou Gehrig's, you name it, right? And all the other chronic conditions. Just want to thank you for the work that you've done in the past, 21st Century Cures Act, things like that. You're making an enormous difference in people's lives every day. In 1st District, Minnesota, Southern Minnesota, I happen to represent one of the great preeminent institutions of medicine in all the world, the Mayo Clinic. And of course, they provide timely quality medical care to people from all around the world, and we're very lucky to have them. And they also do some of this basic research that flows from NIH and in a number of areas, but particularly in cancer. And I also would like to put in a plug for the Hormel Institute. Okay. I got kicked out of, oops. I got kicked out. Are we back on?
Hear you. Go ahead. Yeah.
Okay. And so also the Hormel Institute in Austin, Minnesota, where they're doing all sorts of incredible research on behalf of folks that have cancer, and they partner with the Mayo Clinic and the University of Minnesota. So even in southern Minnesota, a lot of these things are getting done. This is a particular issue that hits close to home for me. A little bit over 2 years ago, I was diagnosed very unexpectedly with stage 4 kidney cancer. And my doctor told me not too long ago if I hadn't been diagnosed and treated with something that worked in a short period of time, I'd have been dead over a year ago. That's how serious it was. But I received treatment at the Mayo Clinic the last couple of years, immunotherapy treatment, which is the response has been just fantastic. About 4 months ago, they took out my kidney, and now doctors tell me the latest CAT scans reveal no cancer detected. So a little bit of a mini miracle there. I would say the healing hands of God, Mayo Clinic, and an incredible biopharmaceutical cure called Keytruda keeping me alive. And I know there are a lot of stories across the country, across the world, just that same way, where these new cures that have been coming to market the last 10 years or whatever are keeping people alive. I'm one of those examples. I think everybody knows at least someone who's probably alive today because of these new developments in research just in the last decade. And I'd say there are probably a lot of folks who passed away long ago that if they were diagnosed with their illness today, they might live the rest of their lives, the full length of their lives. And so it's really quite something the way things have evolved. I know, Chairwoman, that you're a cancer survivor as well. As a matter of fact, I have a note from you on my desk that you sent just a few weeks ago talking about how 30 years ago you had ovarian cancer and received treatment, and you've been no cancer detected since then, and you're going along very strongly. So I praise the Lord for that and for the healing hands He laid on you, and we're so glad that you're in this position all these years later in order to do this good for the American people and for folks that are afflicted by the disease. So I really would encourage the monies to go to the Cancer Institute to make sure that the monies flow to NIH. I know you'll be looking at that, and whatever the committee and subcommittee can come up with, I'll certainly support it. Just a couple other things. I think one great development in the last couple of years was getting rid of that medical device tax. That was something that was kind of limiting innovation and things that help people live better and longer lives. And what we've seen in the last year with the coronavirus, the telemedicine's really taken off. And in a rural district like mine, elderly population and everything else, I think that's something that hopefully the subcommittee and Congress will be able to continue to lessen regulations and to make sure the reimbursements are there for folks that utilize those services. I've spoken with patients and doctors alike, and I think it's really something, and let's keep doing that. There have been some riders in the past on the issue of abortion and so forth. I hope the committee will continue to keep those pro-life riders in there. They've been pretty much non-controversial for a long time. I hate to see it become controversial in the future. So with that, Madam Chair and Ranking Member, I just yield back and say this. I mean, you fight cancer each and every day. I can attest to that. You can as well, Chair. And we just let everybody know out there that cures are coming to market every day. The basic research is being done. Incredible things are on the horizon. People just encourage them to keep fighting. We're going to stand with them, and we'll all do it together. So thank you.
Thank you. Thank you very, very much. And we belong to the same club. Those of us who have, by the grace of God and biomedical research, have survived a cancer diagnosis and cancer and treatment as well. My only view of this is that we have had an opportunity for a second chance at life, and therefore we need to do everything that we can to provide others with that same opportunity. I know that the issue of cancer research and of research at the NIH is one that has a very strong bipartisan support on this subcommittee, and over the last several years have increased funding for the National Institutes of Health by about $11 billion. So I appreciate, your request, and it really dovetails with the direction that the subcommittee has been going in the past, and looking for increased funding for research overall, but research at the National Cancer Institute as well. So thank you very, very much, and we look forward to working with you. Thank you. And yes, it's congratulations to you. It's wonderful. You learn to love life every single day after you've been through the experience. So thank you.
I agree with you, Chair. Thank you. If I may add just one more thing, in the last year, a lot of folks skipped their appointments to go see the doctor regularly or get their cancer screenings. And a lot of people just never went back. So I think you to join me in encouraging everyone to get out there and see your doctor, try to get that early detection.
Amen. It's life-saving. That's exactly what it is. So thank you so much. Thank you.
Thank you.
Okay. Congressman Case.
Chair, Ranking Member, and members of the subcommittee, aloha and mahalo for the opportunity to seek the subcommittee's continued support of critical health and education programs assisting the unique needs of Native Hawaiians in my home state of Hawaii and throughout the United States. Native Hawaiians are the indigenous peoples of our country whose homeland is Hawaii. Our nation's historical and unique legal relationship with the Native Hawaiian community has been consistently recognized and affirmed through laws that extend to Native Hawaiians many of the rights, privileges, and programs afforded to American Indians and Alaska Natives. Just as Native Hawaiians are a unique community within our national fabric, so are many of their challenges and needs, especially in health and education. Specifically, Congress passed the Native Hawaiian Health Care Act to address the severe health needs of the Native Hawaiian population. For example, Native Hawaiians have experienced disproportionately high rates of obesity, hypertension, asthma, diabetes, and other chronic diseases. These disparities are in large part perpetuated because of systemic barriers to healthcare and social determinants of health. Under that act, Congress has consistently supported strong funding for the Native Hawaiian healthcare systems to address these disparities. Specifically, the Native Hawaiian healthcare systems provide primary, dental, and behavioral care, as well as make available health education, health promotion, disease prevention, and Native Hawaiian traditional healing services to fit the needs of their respective communities. Your continued support for the Native Hawaiian healthcare systems is especially needed now as we work to get through the pandemic. I also asked for the subcommittee's supportive report language directing the National Health Services Corp's loan repayment program to recruit and retain providers to work in areas that serve Native Hawaiians and Pacific Islanders. This more carefully tailored funding would help address health workforce shortages and strengthen the health career pipeline while also providing better care and outcome for these traditionally underserved populations. Primarily through the Native Hawaiian Education Act, Congress has also consistently provided federal funding to address the educational attainment gap between Native Hawaiian students and their peers. Native Hawaiians have historically performed below national norms in reading, science, math, and social science, and are underrepresented in higher education. All of these trends have been amplified by the COVID-19 pandemic. That Act's supplemental education services provide for the unique educational needs of Native Hawaiian students and recognize the role of languages and cultures in their educational success and long-term well-being. Native Hawaiian education grants support innovative and effective programs such as the Partners in Development Foundation's Tutu and Me Traveling Preschool and Aha Puanaleo's Hawaiian language revitalization activities and immersion schools. Native Hawaiian education grants also help finance scholarships and college transition opportunities, including career and technical education and science, technology, engineering, and math outreach targeted towards Native Hawaiian students in high poverty areas across Hawaii. Your continued support for the Native Hawaiian Education Program is requested to increase college readiness, access, and success for Native Hawaiian students, especially for those who are most at risk of not attending college. Additionally, the Strengthening Alaska Native and Native Hawaiian Serving Institutions program provides funding for tutoring, mentorships, internships, faculty development, and other initiatives to better meet the needs of Alaska Native and Native Hawaiian students at the collegiate level. In closing, I want to extend my warmest mahalo to this subcommittee for your consideration of these requests in this upcoming fiscal year, and for your continued partnership in our efforts to improve and promote resilience and advancement in our Native Hawaiian community. Aloha, and I yield back.
Aloha, and thank you. Thank you so much for your testimony. And more than just the testimony, your which comes through your deep commitment to making sure that the Native Hawaiian population and others have the health assistance that they need and the educational opportunities they need. And you wanted just a strong advocate you are, Congressman Case, for those issues. And these issues come up every year, and we will look hard at those requests, because I think, once again, this is a moment when, again, the virus has exposed the real disparities and to underserved communities, and what we need to be doing, and whether that is in education or in health or in the economy. So if we can look at how we can begin to build that architecture for the future that puts it's not programs that assists people. We need to be talking in terms of people and not programs, of what this does in terms of turning around the lives of folks in your communities. And so I look forward to working with you as we look to expanding Native Hawaiian healthcare, as we look into the set-asides for Pacific Islanders and Native Hawaiians, and how we move in terms of the education space as well, to give people that opportunity for success. So thanks so much for being with us today. I appreciate it. Thank you. Congresswoman Gwen Moore.
Well, thank you so much. I want to start by thanking you, Chairwoman DeLauro and Ranking Member Cole, for having me here today to speak about a topic that is near and dear to me. I can't smoke. And of course, you can guess it's the federal TRIO programs. It's a program that gave me the tools to succeed at a university when I became a single mother at age 18. When I became pregnant at age 18, I was just starting my college journey. And while 18 years old is when most young people go off to college, live alone for the first time, and find their independence, I became a single mother. I can tell you
for 1 second
that luckily my journey at Marquette University brought me in touch with the federal TRIO program. Without TRIO, Madam Chairwoman, Ranking Member, I would not have been able to balance being a college student and raising my beautiful daughter, Jesselyn. Without TRIO, I would not have been able to graduate, join the AmeriCorps Vista program, become a community activist, and eventually even run for Congress. TRIO gave me the tools to be successful, and it's been the honor of my life advocating for this program on a bipartisan basis. And I hope that to be able to pay it forward by advocating for it now. Programs like TRIO help level the playing field. It's rooted in the civil rights movement. The successful federal TRIO program is made up of 7 unique programs that provide mentoring, academic guidance, and financial support to first generation or low income students, as well as students with disabilities, military veterans, and other underrepresented groups. By us supporting this consortium of people, according to the Department of Education, TRIO support services undergraduates at two-year institutions were 47% more likely to complete their degree or transfer to a four-year institution. First-generation military veterans enrolled in the TRIO Veteran Upward Bound programs were 42% more likely to complete their degree than those not enrolled. And high school graduates enrolled in the Upward Bound program, over 80% of them enrolled in college immediately. Unfortunately, due to limited TRIO funding, less than 5% of first generation and low income students are able to participate in these programs. And so, Madam Chairwoman and Mr. Ranking Member, I just want to remind you that the results are clear. Federal TRIO programs provide students, all kinds of students, every race, creed, color, area of the country, the tools to succeed. And this has been a hard year for students across the board. And that's why we must triple funding for TRIO so we can bring students back into the fold, all while increasing graduation rates. And you know what? My colleagues agree. This year, I gathered an unprecedented 248 bipartisan signatures of members of Congress who all support increasing funding for the program. And why is that? Because they realize that our legacy in the world is going to be to have the most educated, diverse group of students in the world. As an alum of the program and as the co-chair of the TRIO caucus, I thank you for your attention to this matter, as well as your continued support of the federal TRIO program. I'm so excited to work with the Appropriations Committee on expanding funding opportunities and ensuring that students are given the tools they need to succeed. I also want to thank the chairwoman and the ranking member for their consideration on my community-funded projects. I look forward to working with you and the committee on implementing these transformative initiatives. And I thank you, and I yield back.
Thank you so much for your eloquent and impassioned statement around the TRIO program. And you did highlight that there's 248 bipartisan signatures for a program that across the aisle we all believe has such power and potential to change the lives of young people, like in fact you've recounted about yourself. And I know that the members of the subcommittee feel as strongly as you do about the benefits and the value of the TRIO program. So we look forward to working with you on that effort as well. So never stop, with your impassioned advocacy. It helps to make a difference. And we thank you so very, very much for being here today. And thank you for participating in the Community Projects Funding Program. I think it was going to be enormously helpful to the constituents who you represent and who put their faith and trust in you to be working on their behalf. So thank you very, very much for being with us today.
Thank you, Chairwoman DeLauro. Thank you, Ranking Member Cole.
Thank you. Thank you. Congresswoman Jackson Lee.
Madam Chair,
Yes.
can you hear me?
Yes, I'm here. I think we're all here. Lucille Roy Ballard is on. I don't know. I saw Congressman Case, but we're here. So please go ahead with your testimony.
Thank you so very much. It's been interesting to try to get on, but I will take this opportunity, first of all, with a big appreciation to you and the subcommittee and the ranking member and the full committee for helping us do great things for our constituents. I wanted to start off with my commitment to issues dealing with educational opportunity, health research and security, economic opportunity, and workforce safety. And programs that are very valuable that are under this subcommittee. I want to emphasize the historically black colleges and $395 million for historically black colleges and universities and PBIs. The block grant child care, of course, I want to go big on child care, which would include the President's American Jobs Plan, but I support a robust funding for child care and development block grant. The TRIO programs that have served in my constituency, about 760,000 students have benefited from that. Support $12.5 billion for individuals with disabilities, $27 million for minority centers of excellence. Support for magnet schools, again, $42 million for historically black colleges, capital finances. These schools are mostly Civil War schools. They were built and organized during that time. The capital program is so enormously important. And Chairwoman, you may remember that the Congressional Black Caucus with Whip Clyburn have worked on these issues in the past, dealing with capitalization for our schools. $11.5 billion for Head Start. One of my major agencies in my district is an age-old Head Start that has helped thousands upon thousands of families. $5.1 billion for community health centers that have been instrumental during the pandemic. Work on the National Institutes of Health that have been constructive in the research that is necessary. We don't know when the next pandemic will turn the corner, and we need the National Institutes of Health. $320 million for the National Institute of Minority Health. That's and health disparities, which I worked on when I first came to Congress. $10 million for the lead poisoning. And of course, we're still waiting to pass the Violence Against Women Act in the Senate, which is shameful in terms of the Republican response, but I'm grateful for the full funding for violence against women health initiatives, school-based health, homeless veterans, family planning, and then economic opportunities. Job Corps has been instrumental in my district. I support a robust funding for Title VII, nursing workforce. And let me emphasize that during the COVID, I used student nurses to work with me on roving vaccination sites. Roving vaccination sites. I want to promote nursing and the nursing workforce more than ever before. And I want to improve the access for diverse persons, men and women, Hispanics, African Americans, Asian Pacific, Southeast Asian, African, in terms of Africans from Africa, because nursing has proven itself to be crucial and life-saving. $700 million for OSHA, and then I support $25 million for the Services to Survivors of Torture program, $400 million for the implementation of trafficking. Houston is the epicenter of trafficking, if you might believe it, in the United States. And we have confronted trafficking houses, smuggling, of course, but just outright human trafficking, and particularly among young people. We worked on that, and and very important that. And finally, refugee and entrant assistance funding. I supported the president raising the caps and think it is very important. Finally, Madam Chair, I just want to say this. January 6th was pervasive. It was everywhere. And I do think it is important that report language be included in all of our committee appropriation mark, that the committee would caution and direct the secretary of the particular agencies to exercise vigilance and take decisive action to identify, isolate, and remove from service individuals whose actions of January 6, 2021 at the U.S. Capitol, or whose connections, actions, or affiliations, this does not in any way diminish and deny due process of and the right to free speech, but affiliations or with white nationalist organizations that pose a threat or now pose a threat to the national security of the United States. It's been documented that federal employees were involved in these efforts on January 6th, and I do believe it's important to be attentive to the dollars of this of taxpayers, and for those dollars to be represented fairly and safely in all of our agencies. I thank you, and I thank you for giving us the opportunity for community projects. I know we'll have an opportunity to discuss that at a later time. Thank you very much, Madam Chair and the Ranking Member. Thank you very much to Chairwoman Robau as well, Alec Robau.
Thank you so much for your testimony, and I think you have laid out the full scope and vision of the Labor HHS subcommittee, and how, in fact, the work of this subcommittee affects the lives of Americans across our country, especially children and families and seniors. And I really love your roving vaccination sites effort, and so I think it can help to be a model for other areas of the country. And it took note of your issues on trafficking and the situation in Houston, and also we are a nation of immigrants and a nation of refugees as well. So I thank you for that, and we look forward to working with you as we craft the bill for 2022. But thank you for understanding the full scope, and let's stretch the edge of the envelope when it comes to what we might be able to do through the Subcommittee on Labor, Health and Human Services and Education. So appreciate your testimony today, Congresswoman. Thank you.
I look forward to it.
Thank you.
Thank you. Good to see you, Mr. Cole.
Thank you. And let me now.
Just got here.
Oh, thank you. There you are, Congressman Cole. Great. Thank you. It's great to see you.
Well, it's good to see you again. You know where I've been, Madam Chair.
Oh, I do. So please, we are now going to recognize Congressman Barr from Kentucky.
Chair DeLauro, can you hear me?
Yes, we can.
Great. Ranking Member Cole, good to see you. Thank you very much for the opportunity to testify. I want to thank both Chair DeLauro and Ranking Member Cole for your support of heart valve research and medical research generally. Both of you have such an incredible track record of advocacy for the National Institutes of Health, and I appreciate your willingness to listen to my efforts to honor the legacy of my late wife through the Carroll Act. As you may know, on June 16th of last year, I tragically lost my wife, Carol, to sudden cardiac arrest. She was only 39 years old, just a few weeks away from her 40th birthday and just a few days off from our 12th anniversary. She was the best wife, mother, daughter, and friend anyone could ever have. The medical examiner and Carol's doctors told us that her fatal heart attack was likely brought on by a ventricular arrhythmia. At a young age, Carol had been diagnosed with an underlying condition called mitral valve prolapse. We knew about this. It's also called floppy valve syndrome. It's typically a benign condition that results in sudden cardiac death only in 0.2% of the cases. Certainly, we had no idea that her life was in jeopardy. Her doctors didn't even know that her life was in jeopardy. She didn't know. The American Heart Association reports that isolated MVP and sudden cardiac death predominantly affects young females with redundant bileaflet prolapse, with cardiac arrest usually occurring as a result of ventricular arrhythmias, which is when the ventricle just doesn't pump. According to the National Heart, Lung, and Blood Institute, heart valve disease occurs if one or more of your heart valves do not work well. Many people in the United States have heart valve defects or disease but do not have symptoms. For some, the condition remains the same throughout their lives and does not cause significant or life-threatening problems. Unfortunately, over 25,000 people die each year in the United States from heart valve disease, primarily due to underdiagnosis and undertreatment of the condition. Specifically, Carol's condition, mitral valve prolapse, is a common valve disease that has an estimated 2.4% prevalence. Though most cases are thought to be benign, reported complications such as severe mitral regurgitation can result in sudden cardiac death. Medical research has found an association between MVP and sudden cardiac death. Predictors of this outcome, however, are not readily available, just as they weren't in our case. Underlying mechanisms are poorly understood and indicators of high-risk individuals are lacking. Despite several studies, there is not sufficient data to generate prescriptive guidelines for care of patients with valvular heart disease, including MVP. We were always told, Carol was always told, this is not a big deal. We just have to monitor it. Well, we were monitoring it. She did go to the cardiologist, and there was no way for the doctor to predict this catastrophic event. That's why, inspired by the extraordinary life of Carol, I introduced the Cardiovascular Advances in Research and Opportunities Legacy Act, or the Carroll Act. This legislation will address the gaps in understanding about what risk factors make valvular heart disease a potentially deadly condition. More specifically, the bill will authorize $20 million for 5 years to establish a grant program administered by the NHLBI to support research on valvular heart disease, including MVP. This research will advance technological imaging and precision medicine to generate data on individuals with valvular disease and develop prediction models for high-risk patients, enabling interventions and treatment plans to keep these patients healthy throughout their lives. And surgical intervention works in these cases. We didn't know we needed the surgical intervention. That's the problem here. Additionally, legislation will convene a working group of subject matter experts to identify research needs and opportunities to develop prescriptive guidelines for treatment of patients with mitral valve prolapse. It will also instruct the Centers for Disease Control to increase public awareness regarding symptoms of valvular heart disease and effective strategies for preventing sudden cardiac death. The Carroll Act has garnered the bipartisan support of over 140 of our colleagues, and companion legislation was introduced in the Senate by Minority Leader Mitch McConnell and Kirsten Sinema, our former colleague here in the House. Additionally, it has the support of over 20 medical groups, including the American Heart Association, the American College of Cardiologists, and Women Heart. To further advance our efforts, 16 of my colleagues joined me in a letter to request $20 million in the FY22 Labor H Appropriations Bill to be directed to the NHLBI to address the gaps in understanding about what risk factors make valvular heart disease a potentially deadly condition, and be specifically administered to accomplish many of the same research initiatives as in the Carroll Act. In drafting this appropriations request, we worked specifically and very closely with Dr. Gary Gibbons. I spoke with him personally about this and his team at the NHLBI to ensure our efforts would properly respond to their needs as they requested to complete this work. Though there is some ongoing research at the NHLBI on valvular heart disease and specifically MVP, the $20 million figure goes to the expansiveness of the research needed to examine the risk factors associated with valvular heart disease and sudden cardiac death and develop these prediction models and guidelines for high-risk patients. Through this research, I truly believe we can save lives, we will save lives, and help families avoid the tragedy that has profoundly affected mine and my girls, Eleanor, age 10 now, and Mary Clay, age 8. Again, I thank you so much for your time and for your support. This is a worthy cause. It's obviously very, very personal to me, but I can tell you that in talking to scores of cardiologists in the last 11 months, they need better tools and guidelines to help predict this, because they can save lives if they just know who is at high risk, and they certainly did not know Carol was. So I appreciate your consideration, and I yield back.
I say thank you to our colleague and really for being here and taking what is such a personal tragedy for you and for your girls and your extended family, and utilizing the effort that we have in serving in this institution, which in fact looks at biomedical research, which can be so critically important in helping to save lives. So we thank you for your courage in telling your own story. We can never take away the pain in your heart, but what we can do is to talk to you about how we can work together to see if there the opportunities for research that can address this problem and make sure we are developing those guidelines for the treatment of patients with the mitral valve prolapse. So let's keep talking about this. We have talked before, but thank you so much for coming forward today and taking this issue on squarely. And my mom used to say to me, never give up and don't take no for an answer. So there you go. And with that, let me yield to my ranking member, Congressman Cole, for any comments.
Madam Chair, your mother would be very proud, as I know she was, because you certainly lived by that admonition. I too want to, number one, associate myself with our chair's remarks, and want to thank my good friend from Kentucky for being here, and honestly for taking such a shocking and unsettling personal tragedy and turning it into to something so productive that can help so many people. I mean, it just says a lot about you, my friend, that this is how you reacted to what had to be just a staggering blow to you and your family. And certainly it's a great shock to all of us that have the privilege of serving with you in this institution. But I couldn't be prouder of what you're doing. And certainly it couldn't be more supportive. I know that Chair shares those sentiments as well, and we'll certainly see what we can do. You know, never apologize for saying, I know this is personal to me. You know, good legislation is usually informed by personal experience. And one of the great things about the Congress of the United States is we have a lot of people with a lot of different experiences, and they educate us all. There's an old saying by the famous Oklahoma humorist and political commentator Will Rogers, we're all ignorant only about different things. And, you know, we're informed by other people's knowledge, which is usually, you know, based on their experience and what they know. And you've done a great deal to inform all of us about an area that affects a lot of our constituents. And yet, perhaps we didn't know. I certainly didn't know down to the technical detail that you've given us here and what would be the appropriate things that we could do to address it. So thank you for bringing your personal experience, tragic though it truly is, this committee and benefiting. And as my chair often says, this is the people's committee. We probably have more impact on more people than any other committee. And you know, we try to take experiences such as yours and learn from them. And that's why this committee has been on a bipartisan basis for many years. So strongly supportive of the National Institute of Health and some of the other agencies that we have that put these problems front and center and that deserve our support because they make such a difference in the lives of our fellow Americans. So thank you again for bringing it here. We certainly look forward to working with you, and we share your grief, but we take considerable pride in the way that you've handled it and the way that you've turned it to such a positive thing for all peoples. So thank you again.
Thank you for your kind words, Ranking Member Cole, and your kindness, and Chair DeLauro, thank you also for your kindness. As we've talked about this, I really appreciate your words and for your persistence over the years in fighting so many diseases.
Thank you. Thanks very, very much. Thank you. And with that, let me recognize Congressman Jamal Bowman.
Thank you, Chair DeLauro and Ranking Member Cole, for the opportunity to testify before the Appropriations Subcommittee on Labor, HHS, and Education today. As a former teacher, school counselor, and principal, I think it's only right that the subcommittee responsible for education funding at the federal level enjoys the largest share of non-defense spending. I deeply appreciate the incredible work this subcommittee carries out under your leadership, not only for our regular fiscal year spending, but for the COVID-19 relief packages as well. I'm here to testify in support of programs that directly impact children in my district, which covers parts of the Bronx and Westchester County in New York, beginning with Head Start. The first 1,000 days of a child's life have a tremendous impact on their brain development, their physical and social emotional health, and their long-term outcomes into adulthood. Without the right supports in place, our children are vulnerable to adverse childhood experiences, or ACEs, but ACEs are preventable. Every child deserves supportive caregiving with wraparound services in a healthy, trauma-informed space to learn and grow into their full potential. I asked the subcommittee to dramatically increase our investment in Head Start. Head Start takes a community-based, comprehensive approach to early childhood education, and we should do more to expand their work, including early Head Start childcare partnerships which serve infants and toddlers in my district in Mount Vernon, New Rochelle, and Yonkers through the Westchester Community Opportunity Program. I ask that the subcommittee increase Head Start funding by at least $1.3 billion for an overall level of $12.1 billion in fiscal year 2022. I urge that we consider this the floor because we need to fund Head Start along with the other core birth through 5 programs like CCDBG, preschool development grants, and IDEA Part B, preschool grants, and Part C at the highest feasible levels. I also want to talk about full service community schools. The community-based comprehensive approach taken by quality early childhood education programs is an approach our K-12 system should take greater efforts to adopt. The full service community schools program has shown that we can accomplish what we can accomplish when we harness schools as community hubs that support students, families, and communities holistically. However, the current funding level for full service community schools makes them too rare. I am speaking to you as the founder of a community public school and as someone who authored a dissertation on the importance of community schools. I ask that the subcommittee consider robust funding for the program. Communities in New York 16th Congressional District would greatly stand to benefit from the expansion of full service community schools. I now want to address briefly IDEA. I especially wish to highlight our need to invest in IDEA. The Individuals with Disabilities Education Act has been enacted since 1975, but we have always fallen short of our mandate to pay 40% of the average per pupil expenditure. On the Education and Labor Committee, we recently held a hearing on the impact of COVID-19 on our students with disabilities. We heard directly from a special education teacher who made clear we are in dire need of additional resources, including more special education teachers to support our students meaningfully. In fiscal year 21, our IDEA Part B funding didn't even cover half of what we owe our students. And I ask that the committee allocate funds such that we are on the most expedient path to fulfilling our federal mandate. Finally, I want to discuss our teachers. Title II-A, supporting effective instruction and leadership. Our investments in children would be nowhere without our teachers. The people responsible for educating our children should be a priority as we work to recover from the pandemic and build our education system back better than ever. I ask that the subcommittee include $3 billion for the Supporting Effective Instruction State Grants Program for fiscal year 2022. According to the Institute of Education Sciences, 88% of urban and suburban school districts use these funds for professional development. Investing in this program will increase our students' access to quality, effective teachers and school leaders. It was Teacher Appreciation Week at the beginning of May, and I ask that we show appreciation for our teachers in our federal budget. Thank you so much for your time, and I yield back.
I want to thank you so much for your testimony today, because you've hit on issues that are really near and dear to the heart of both the majority and the minority, and it's a very bipartisan approach that we have taken to these issues. I might tell you that for fiscal year 21, Head Start was $10.75 billion, which was at a record high. That is not to say there isn't anywhere else to go in that effort, but the recognition of the importance of Head Start and what it means for a child and the child's future is critically, appreciated by this subcommittee. I personally, on the whole issue of community schools, and where we have put in if you will, a pilot program for community full service community schools. I come from a background of where I taught at a community school in New Haven, Connecticut, the Dr. Harry A. Conte School, and I watched students, and I might, more power to you in really be, founding a community school. The school was open from early morning until late at night, with teachers, with children, with parents, with grandparents, everyone. And the value of that community school, unfortunately, got lost in the years, but I'm delighted to see it making a resurgence. And we will certainly, I tell you, we'll focus on that. I will mention to you in the president's request, he's proposing an increase of $2.6 billion for IDEA. It doesn't get us to what we have promised, but it certainly is one of the most impactful budget items that we have seen in a very long time with regard to IDEA. There isn't any question about the teacher training, and what has always been of concern to me is that in underserved areas, that the children who attend school in these areas in high poverty areas are victims because they don't have all of the resources, including the highly trained teachers that they need to help them make it through. So that your comments and your advocacy on these issues is not fallen on deaf ears overall for this subcommittee on a bipartisan basis. So thank you very, very much. And let me yield to my colleague, the ranking member, Congressman Cole.
Thank you, Madam Chair, and thank you, Representative Baldwin. We appreciate your advocacy. I agree very much with what the chair had to say, and frankly, she's much too modest in her own efforts, particularly where Head Start's been concerned. They're coming off of the biggest increase that they've gotten, at least in my tenure in Congress, and that's thanks to her effort. Both of us have worked hard on that issue over the years. I couldn't agree more with you about IDEA. I always do like to point out, though, that go back and read the law. It says up to 40%. So, and the closest we ever got is actually when our former speaker, John Boehner, was head of your committee and labor. He got us up to 22 or 23%. That was always a matter of emphasis, and it's a moving target. But it's the thing I love about the program is it puts money behind kids that need it the most, and it gives educators a lot of flexibility. I mean, I just think this is really one of our most important programs. The biggest challenge, of course, is just everything you've laid out is important, honestly. And I don't think this committee ever has enough money because the needs are genuine. And I say that with all sincerity. I say that as a conservative Republican. But I am proud of the fact that for 6 years, 4 of which I was chairman, 2 of which are current chair, we voted together 6 times in a row to pass this bill. And it had many of the priorities in it, no matter what money we had. And we always live under a budget agreement, or we did for the last 10 years. Anyway, we'll see what's negotiated between the administration and the powers above us. But as someone who's had the privilege of serving as a chair for 6 years on the subcommittee, I can assure you your priorities will be given the maximum consideration. And as I joke with my colleagues, we're probably pretty fortunate to be on the subcommittee with the chair of the full committee, because we're probably going to fare a little bit better on the allocation front than might otherwise be the case. But anyway, thank you very much. Thanks for your service before you were in Congress. Thanks for coming here and being such a passionate advocate for education and for children and for equality of opportunity. Those are things that ought to always unite all of us, and your service is much appreciated.
Thank you both so much. I appreciate the time.
Thank you.
Congressman Thompson.
Well, Chairwoman DeLauro, Ranking Member Cole, and members of the subcommittee, good afternoon, and thank you so much for providing the opportunity to share my priorities for fiscal year 2022, labor, health, and human services, and education appropriations. For our country to continue to thrive, we must support programs aimed at improving lives and shaping futures. Additionally, we remain dedicated to strengthening our workforce to stay competitive in the global economy. Under programmatic requests, my first is career and technical education. As co-chair of the bipartisan House Career and Technical Education Caucus, I strongly support CT programs to provide learners of all ages with career-ready skills. During the 115th Congress, we unanimously passed the first major overhaul to the Carl D. Perkins Career and Technical Education Act since 2006, the Strengthen Career and Technical Education for the 21st Century Act. The bill was signed into law by President Trump July 2018, and it aims to close the skills gap by modernizing the federal investment in CTE programs and connecting educators with industry stakeholders. And for these reasons, I respectfully request the Carl D. Perkins Career and Technical Education Act be funded at the highest possible level for the fiscal year 2022. Community Services Block Grants. Community Service Block Grant is the only federal program with the explicit goal of reducing poverty regardless of its cause. CSBG pursues this goal by providing critical funding to the nationwide network of over 1,100 local community action agencies and supporting their locally driven comprehensive approach to fighting poverty. And for these reasons, I respectfully request $800 million for the Community Services Block Grant for the fiscal year 2022. Statewide family engagement centers are another area. They provide vital direct services to improve collaboration of engagement between children and parents and teachers, school leaders, and other school personnel, resulting in positive impact on a child's education. And for these reasons, I would respectfully request $20 million for statewide family emergency or engagement centers for fiscal year 2022. In terms of community project funding requests, I want to start with the Jeff Tech Farm to Refrigerator Training Facility project. Through the North Central Workforce Development Area in Pennsylvania, there's a growing need to have qualified and trained meat processors, butchers, meat cutters, whatever the terminology. COVID-19 only amplified the need to fill these positions with concerns of the impact to the national food supply chain. And to further make this point, I'd like to submit for the record 2 articles, one from the Wall Street Journal and the other from one of my alma maters, Penn State University, just reiterating these concerns nationwide. To address these shortfalls, Jefferson County Du Bois Area Vocational Technical School, located in Jefferson County, Pennsylvania, is looking to construct a training facility providing the resources and the skills development to teach individuals how to process various types of meat. And this will allow graduates to be placed into high-wage, family-sustaining jobs, while also providing a tremendous and lasting boost to the local economy, local farmers, the meat processing industry, and avoiding any type of disruptions like we saw during 2020 with the food supply chain. So for these reasons, I respectfully request $1.5 million from the Training and Employment Services account to complete this project. Center Volunteers in Medicine Clinic Construction Project. According to the 2021 County Health rankings, approximately 11,400 people in Center County, Pennsylvania do not have health insurance. The Center Volunteers in Medicine, located in Center County, Pennsylvania, is a community health resource center providing health care services to those without health insurance and whose household incomes is 250% or lower than the federal poverty level. Should the committee look favorably upon this project, CVIM will be able to renovate their newly purchased facility to provide over 10,000 square feet of medical space for these residents. And for these reasons, I respectfully request $1,060,912 from the Health Resource and Services Administration account to complete this worthwhile community project. And then the Rural Pennsylvania Mental Health Substance Abuse Initiative. Rural Pennsylvania has one of the highest rates of drug addiction throughout the Commonwealth. And this project objective is to bring rural Pennsylvania the latest technique available in this treatment and prevention of mental health issues, particularly drug or alcohol abuse. And for that reason, respectfully request $1,017,000 from the Health Surveillance and Program Support account to complete this worthwhile community project. And I really appreciate the opportunity to be able to offer this verbal testimony and obviously submit my written testimony as well.
Thank you very, very much. And again, on a number of the issues that you have addressed today, and I think about the career and technical education, where there is a very, very, again, bipartisan approach to looking at what we want to try to do. We have 70% of the people in the United States who do not have a 4-year a college degree. Now, it's wonderful if you can have one or you do want to, but if you don't, you shouldn't be relegated or kicked to the curb and have no economic future. So that way, we're very, very concerned about the career and technical education effort, and appreciate what the bipartisan caucus in this area does. So we will, take a look at, obviously where we can go, and I know your request is the highest level that we can, achieve here, but so that you do know what a high priority career and technical education is as well. And same with the Community Services Block Grant Program, which for 2021 was $745 million. We understand you're wanting to move to 800 million, but again, CSBG is a lifeline to so many of our communities, including my own, and they've relied on this, for years, in dealing with anti-poverty, and really addressing some of the very critical concerns. And it's also a place where you engage with the public and private sector together to address some of these areas. I thank you for recounting your community project funding request, and I thank you for participating in the program. I think we all view, or at least a lot of us view, that this is, appropriations is about the power of the purse, and no one knows their districts better than members of Congress and the granular level and the needs that are there. And I have found it very personally rewarding in the last couple of weeks since the database closed, but the commentary that folks have really gone out on both sides of the aisle into their communities just to find out what the needs are. And no one is just making these up out of their head. They're going out and soliciting the information. So we look forward to working with you as we move forward. But thank you so much for your testimony and for your interests.
Well,
Really.
thank you, ma'am. I appreciate the opportunity to be able to represent the folks at home and have them bring me their projects. I obviously didn't put forth everything that they brought to me, but it was my responsibility to vet and to choose what I thought had the best common good. And I really appreciate the opportunity and the process to do that.
That's great. Thank you. Thank you very much. And now let me yield to the ranking members, Congressman Cole.
Thank you very much, Madam Chair, and it's good to see my great friend from Pennsylvania. I think you're our most forceful and faithful advocate for career tech, because you are here every year on Member Day with that message, and agree very much with what you have to say and what the chair had to say. Again, that's we're very proud of the career tech system we have in Oklahoma. We think we're one of the very best in the country, and the federal support is absolutely critical to that. And I think the chair made the key point. 70% of the young people that we deal with never going to have the opportunity or the inclination, or both, to go to college. And those folks need to have good career opportunities that will pay well and provide for them and their families, and frankly, strengthen our country. Those are skills that we need. I think politicians are a dime a dozen, plumbers aren't. Electricians, and my dad was a career airplane mechanic, and so is my brother. And frankly, they always had an easier time getting the job than I did. So they knew what they were doing and were good at it. And we need people with those skills. So your advocacy is much appreciated. I agree very much, by the way, with what you had to say about, and what the chair had to say about the CSBGs as well. That's been an area of priority for me for the last several years, both as chair and ranking member. Just as I see the incredible work. I've got a lot of rural poverty in my district. We all have poverty everywhere, but a lot of our community action groups just do an unbelievable job in helping people and getting them hooked up with services and providing services for them. I really saw it during coronavirus. We had a lot of people very isolated, in a lot of trouble. These groups just did outstanding work. And a lot of the legislation that we passed jointly on a bipartisan basis last year provided a lot of additional resources to these groups. I think it was well spent and made a difference getting through the pandemic. On your community projects, I suspect we'll have more of them than we can ever fund completely. You know, and that's okay. That's part of what appropriators do is make choices. But it'll be interesting. I think I'm going to join the chair and thank you for your robust advocacy here. As you know, there's some differences of opinion amongst members about this, and I respect that. But I'm like you. I think you get sent here to represent your district. You know it well. You got to have the opportunity to provide that insight, and then other people can evaluate it and make the tough choices that they have to make. I must say, though, you mentioned that you didn't send forward every request. You know, the chairwoman's made it a lot tougher for us. You got to list all these things now. In the old days, you might not mention that you didn't send it forward, and they wouldn't know, or you might send them all forward knowing that one hadn't got a prayer, and avoid. So this was actually put a lot of accountability on the members making choices. So I don't know that I enjoy it all the time, Madam Chair, but I think it was a good reform. I think these reforms are good, and I think we probably have an extra obligation to be careful in these programs this year. And as we get back into this a little bit, make sure that they all withstand scrutiny. And I have no doubt, knowing my friend from Pennsylvania, that yours will. So, whether they get funded or not is one thing, but I don't have any doubt they're quality proposals and serious suggestions from serious members. So glad you took the time to come to us again this year. It's always a pleasure to hear from you. And again, I really appreciate the consistent advocacy for career tech. And that's part of our population that probably doesn't get the attention it deserves. We talk a lot about college programs, and I'm proud of some of the things that we do on this committee through things like TRIO to help first generation college students get a chance to go. But that's not the route for everybody. And very important we remember that the important jobs and services that folks that work with their hands, so to speak, or have technical skills provide. And the economy can't work without them, for sure. So thank you for being their voice in Congress for all these years that you've been here. With that, Madam Chair, yield back.
Thank you. Thank you very, very much. Oh, let me now recognize Congressman Bill Rockus.
I believe it's afternoon. Good afternoon, Madam Chair.
Right.
Good afternoon, Ranking Member. Two of my favorite members in the House, really. And it's an honor and a privilege to testify before you. I actually submitted 10 community project funding requests, but this was my priority, my top priority. And I'm requesting $2 million in funding for the community health centers of Pinellas County in Florida, in the Tampa Bay area, to expand on the mental health, behavioral, and substance use disorder services in Pinellas and Pasco counties, again in Central Florida, West Central Florida. Our community, much like many across the state and nation, have seen a tremendous spike in mental health related tragedies over the past year. This includes overdose deaths, unfortunately suicides, incidents of domestic violence, and elderly and child abuse cases. Unfortunately, the pre-pandemic rates for these societal problems were already among some of the highest in our state and nation, Pasco and Pinellas counties. The pandemic just exacerbated the problem. Despite increases in federal funding in recent years, Florida remains among the nation's lowest in per person funding for mental health services and substance abuse treatment. And I know that there are folks that come to Florida specifically, more because of the weather, but they have relatives living there to get this type of treatment. Many who are seeking help still can't access quality treatment, and that needs to change. Community health centers have proven to be an effective model for delivering high quality health care. I know you know that, including mental health and substance abuse services to those who are insured, underinsured, and uninsured. However, they simply do not have the funding to meet the dramatic rise in need for these services within our community. I have always been a strong proponent of community health centers because of the remarkable track record of success. I believe they are part of what is right in our healthcare system, and I know that's a bipartisan view. They offer an integrated medical home approach to healthcare that leads to successful patient outcomes and cost savings. As a trusted existing partner in our community, and that's why I chose them, I believe they are the appropriate entity to help fill the incredible gap in our community that exists as a result of the pandemic. With this funding, the community health centers of Pinellas County will expand their outreach to people during their toughest times by establishing 2 new facilities targeting mental health and substance use disorder services in the Tampa Bay area of Florida. This would include 1 facility in Pinellas County and 1 facility in Pasco County. Now, the Pinellas County facility has yet to be decided. It may not even be in my district, but again, I don't care. I want to help these people. The proposal has the support of the Pasco County Commissioners, as well as the Florida House Representative Chris Lavella and Florida State Senator Darrell Roussan, who represents the area. Lastly, I want to acknowledge the amazing work that the community health centers does and what they've been able to do during the pandemic. They've been a godsend. The organization opened one of the first multiple testing sites for COVID in both Pinellas and Pasco counties. The community health centers provided primary care services to over 76,000 patients, including 40,000 COVID tests, and administering over 20,000 vaccines and counting. It is this track record of success and community trust, along with their accreditations by the Accreditation Association of the Ambulatory Healthcare and the National Committee for Quality Assurance, that makes them deserving as a Community Project Fund recipient. Their history certainly proves that they will be a good steward of funds as they expand to address the mental, behavioral, and substance use disorder needs of our community. And again, Madam Chair, I've been working with the community health centers for years, and I approached them about this issue, and they said, yes, we would love to expand our outreach, and I know how vital this issue is, how important it is to all of America. So thank you very much for giving me the opportunity. And again, that is my top priority. I know this is HHS, but it's my overall top priority as far as earmarks are concerned. Thank you. And I know we're not supposed to use that word, but but this is a great one.
I hear you. I hear you. We both hear you. And thank you so much. Thank you for coming, to testify today. It really means a lot. And, the time, the thought, the effort of going into the really in depth as to, the community health centers in both of the counties. Yes. And it just falls within our bailiwick. It's health and human services. And I think you just highlighted and described, I think, the significant role that community health centers play in our country and in our states, but in our healthcare system. This is often the place where folks go for their primary care. It's now probably up to 25 million people that they take care of every year, and they become the anchor in our communities for a range of illnesses, and amongst them, as you pointed out, substance abuse, psychotropic medications, assisted therapy for alcohol abuse, patient care, pandemic-related depression, and they have been, just an unbelievable center. I know mine. I have in my District 3. The Fairhaven Community Health Center, the Cornell Scott, and the Community Health Center of Middletown, Connecticut, and they became the anchors in the vaccinating people, including where I went out with the volunteers in the Fairhaven Community Health Center because it's at the heart of a Hispanic district. And we literally went door to door to sign people up to get, to get vaccinated. And so they are just of tremendous importance. And we recognize that. And oftentimes they have connected with them the behavioral health center as well, which then is treating, some of the behavioral health issues that arise in our communities. So again, an issue I believe which is near and dear to the heart, of mine, and I believe of the ranking member as well, and the extent to which we can make our community health centers part of our public health infrastructure, I think is critical. And you are certainly the best advocate for your two counties. And listening here to you today, they should certainly be honored to know, about your advocacy for them this afternoon. And I might just on a personal note, it's always wonderful to speak with you about a place which is your heritage and Greece, and a place that I've, just truly love and have spent many a portion of the summer there. And hopefully, God willing, that this summer will provide that opportunity again, and look forward to working with you on the drug court. So thank you.
Oh, absolutely.
Absolutely. That is such a wonderful opportunity to help youngsters and so forth. So I thank you for your willingness to be involved in that effort. Thank you very much.
My pleasure.
Let me yield to the ranking member, Congressman Cole.
Thank you, Madam Chair. I haven't been to Greece with Gus Bilirakis, but I've been to his district with him. And I can tell you, nobody knows their district better than my friend from Florida, and nobody works harder for the constituents that he has. I share this love affair that we all have here with community health centers. And when I first got to Congress, we only had 5 of them in the state of Oklahoma. We have over 60 now, and they've become an absolutely indispensable part of our system. And one of the things I like on them, which my friend from Florida touched on basically, is the way they coordinate services together. And they are, as you said, Gus, very cost effective. This is a good use of money providing services to a population that quite often would not be able to get them, and get them in a coordinated way. You may show up with an addiction problem, but you're going to get a mental health piece of that solution as well. And so it's a good use of dollars. It's very cost effective. So you're wise to be advocating them here. And we look forward, you should be aware, and we may be probably, I think, under our chair's direction, we probably had more hearings on mental health, and mental health was a part of in this Congress than I can remember in any other. And I think part of that may be just coming out of COVID and all the problems we had. It's really manifested itself in schools and all sorts of places where we've seen incidents of isolation, depression, addiction, sometimes rising out of that, become more and more common. So having the ability to get people help sort of where they live at a reasonable cost is really a big challenge, and I think something that this subcommittee will be wrestling with, and I'm sure honestly will make significant progress in. So, you not only know your district and know what you need, you're also touching on a national problem that we all have heard a lot of testimony about in the last few months as we've gone through our hearing schedule. So anyway, we'll look forward to working with you. There's real challenges. You're one of the members we have that I consider a problem solver, not a problem maker. So it's kind of always nice when you take the time to come to our committee and express very directly and forcefully, and advocate for your constituents, which is what we're all sent here to do. So, and by the way, please say hi to your mom and dad for me.
Well, definitely. Thank you, Tom.
Thanks. They would be proud of you.
Amen.
Thank you. Appreciate it very much.
You bet.
Thank you.
Madam Chair. Appreciate
Thank you. And now let me recognize Congressman Van Drew for your testimony.
Good afternoon, Chair DeLauro and Ranking Member Cole. Thank you for providing this opportunity to testify before the Appropriations Subcommittee on Labor, Health, and Human Services. I'm here today to advocate for $270,000 in community project funding for the Jobs for America's Graduates New Jersey program through the Employment and Training Services account. The funding is an excellent use of taxpayer funds, having a direct and positive impact on the lives of underprivileged youth. Currently, New Jersey is the only state, and I'd like to repeat that, New Jersey is the only state in the program not to receive state or federal money, and there are about 40 different states that are involved. The Jobs for America Graduates Initiative, or JAG, has a 40-year track record of success in working with student populations that are at high risk of not completing their education. JAG New Jersey targets New Jersey high school students and out-of-school youth who have had at least 5 academic, environmental, physical, psychological, or work-related barriers to success, and offers real-world learning experiences that demonstrate how staying in high school and earning a diploma can really enhance their lives. Participating students typically struggle with low academic performance, low income, chronic absenteeism, and home lives that are not conducive to achieving educational goals. JAG New Jersey is currently implemented in 11 programs across the state of New Jersey, helping nearly 2,000 young adults since 2011 complete their education, leading to either a quality job after graduation and or enrollment in post-secondary education and on training programs that put them on a path to a good career. This project has received exceptional community support, which we shared with you, including letters of support from mayors, school districts, nonprofit organizations, and the New Jersey Department of Labor. Community project funding will be used for training, laptops, student leadership conferences, rent, utilities, insurance, academic development training, so important. Most importantly, housing, shelter, referral services, medical attention, and very important as well, life skills training. The coronavirus pandemic has exacerbated the challenges faced by students in the sorts of vulnerable populations that JAG serves. Providing this funding will make a tremendous difference in their lives, a tremendous difference in the lives of underprivileged New Jersey students. I want to reiterate that JAG is the only state, that New Jersey is the only state that JAG is not funded by a state or federal program and receives no aid. I urge the committee to provide this community project funding. I want to say I've personally been involved with JAG. I've seen what it's done for students. I've gone to just about every one, unless we were here, of their moving forward graduation processes. And you see young men and women who've really had a change in their life and really have more opportunity. It's so important. If you catch them at this age and this time, it can change their whole lives and in a way change the country. So I thank you for listening to me, and I yield back.
Thank you very, very much. And I'm really very interested in the program that you're talking about, the JAG program in New Jersey. I just have a question. First of all, let me just say is I think there is no more higher goal than we can achieve through this subcommittee is providing educational opportunity for youngsters, whether we're talking about a preschool, early childhood, and onward to college educations, and to providing them with the tools that they need, and also as you speak about high-risk youngsters and youngsters who may not, finish high school. So how do we then not, again, just leave them to the side of the road? And how do we provide them with the kinds of training and, if you will, a personal infrastructure that allows them to be able to succeed? So I think there's something that's very, very interested, and I think this is something that this subcommittee does focus on, has focused on, and is very, very concerned about on a bipartisan basis. What I am, and I really want to be honest with you, tell me a little bit about the funding for this program, Congressman. Where does it come from? Is it a federal-state partnership? Under what is it coming from? The workforce development funds, just help me to place it so that we can be of help in this area.
Well, and I appreciate your kind remarks. So currently in New Jersey, a lot of it has been entrepreneurs, people that are donors, folks that have just really wanted to help out, school teachers that have been kind enough to actually, and even principals, donate their time to really help with these kids. This is all after school, extracurricular. And in other states, it gets both state and federal money at sometimes. And so it can definitely get both. In New Jersey, we've gotten neither, and we're certainly working with the state as well to try to ensure that there could be some help there as well. It's a relatively modest amount of money, as you see, that we're asking, but it will do a world of good. And I've been personally involved in the program. I've been involved with some of the kids. I've seen the people that are business people, one of them that helps out a lot is a former superintendent of schools, people that are really committed and dedicated because they know, as you so rightly say, how these kids can be lost at the curbside. And once they are, it's really harder to get them back. And so the point here is to get them before this happens. It teaches them things all the way, and it's very flexible, which I actually think is good. Each kid has a different problem. So some of them, they really need some psychological counseling and training. Other folks need to be helped with what we consider simple tasks, but are not for them because they never learn these things. How do you have a banking account? How do you have a checking account? How do you learn, how to take care of certain issues in your life that are everyday normal issues that people deal with, yet you may have never been taught. How do you go food shopping? Because some of them also have children. And even if they don't, how do they go food shopping for themselves? How do they do that in the future? So it's a broad range to help you. And by the way, I forgot to mention, how do you look for a job? We have a lot of programs that do that, but also this sort of puts it all into one package to really help these kids. And at times it's very fruitful, and it really gives you a good feeling when you go to them, when they're moving forward and they tell you what job they've gotten, where they're going, and we present certificates from Congress and talk to them a little bit. And it's an actual nice evening, and their parents are there very often. Those that have parents that are interested, and definitely some do. So their parents get so proud. Their brothers and sisters are proud. It really is a nice program with not a huge price tag.
Yeah, well, that's it. To give these kids a sense of confidence and success is critical. But I look forward to talking with you. We can do that offline to get a better sense of where this program fits and what state and what federal money is going into these programs in other states, and there's just to pursue that with you. So, but many, many, many thanks for coming today and for your testimony. I really do appreciate it. Thank you. And let me yield now to the ranking member, Congressman Cole.
Yeah, quickly, I have really basically the same question. I'm not familiar with the program, but it's certainly a cause that I believe in. My son's a public school teacher and actually teaches in a special unit where the kids that are assigned there are either about to drop out or be expelled. And the motivation that you have for the young people in your area is very much what his is. I remember telling him, he was a math teacher doing other things, and I said, why do you want to do that? And he said, Dad, you could change a kid's life here.
Exactly.
And if somebody doesn't, they're moving in the wrong direction. So I really admire the kinds of things that you're talking about and have seen firsthand the difference it can make. Um, so just out of curiosity, Representative Andrew, is this like, is it a private organization that draws public support and uses money, kind of like a traditional nonprofit, or?
It's a nonprofit.
Okay. Well, anyway, I'm curious, a program like this, why it hasn't gotten federal support when it seems to get federal support in so many other places.
It evidently has in many, many other states.
Yeah.
It just seems to be a peculiarity that fell, and it's relatively new in New Jersey, and some people have really taken it up. In other states, they've probably had it longer. What we're going to do, just to make sure, we're going to get as much research as we can for both of you, ranking member and chair, and just show you exactly the funding stream and how it goes and what states and what they have. But remember, as I said, there are 40 other states where they have it. So
Yeah,
it's not just something.
I'm very interested in learning more about this, and I appreciate very much you bringing it to our attention. And again, this is a cause. If you've got an organization that's helping keep kids in school, we all know what it costs if they don't graduate, and how limited their options are going forward. So, great cause. Look forward to working with you and the chair on this going forward.
Thank you. I look forward to working with you. We'll get you all some information more.
Thank you so
Thanks
much.
Congressman Mervan.
I would like to thank Chairman DeLauro, Ranking Member Cole, and all the members of the Labor, Health, and Human Services, Education, and Related Agents Appropriations Subcommittee for holding today's hearing. My primary purpose for testifying today is to urge the subcommittee to provide $10 million for the Center for Disease Control and Prevention's National Center for Injury Prevention and Control for Child Sexual Abuse Prevention Research Activities in fiscal year 2022. Specifically, the CDC estimates that 1 in 4 girls and 1 in 13 boys will become victims of child sexual abuse. This traumatic experience is associated with long-term physical and mental health issues impacting how children think, feel, and act over their lifetime. Regrettably, in 2020, reported by the Interpol found that the COVID-19 pandemic has increased the frequency of child sexual abuse and the consumption of online child sexual abuse materials. Further, the pandemic has provided abusers additional access to victims while inhibiting children's ability to access victim services, to report their abuse and receive treatment. I believe that increasing funding for child sexual abuse prevention research activities will be a crucial investment in the continued fight to protect our most vulnerable population. This research will be used to clarify the risk factors that promote offending and the protective factors that prevent offending. Most importantly, this research will be used to develop and disseminate effective prevention strategies to ensure that evidence-based intervention practices make it into the hands of parents, educators, youth serving organizations, and other stakeholders dedicated to keeping children safe from sexual abuse. Prior to becoming a member of Congress, I was engaged in advocating for children. On a personal level, my wife is a survivor. Her sister Kelly was a survivor who turned to opiates and who's no longer with us, who left 3 children behind. My wife wanted to be able to have uncomfortable conversations and make sure that children were educated about the prevention of child sexual abuse, and that parents, educators, and children talked about prevention. We went into the schools. We talked to over 12,000 students, 12 through K, or K through 12, in a collaborative effort with the U.S. District Attorney's Office, the faith-based community, Child Protective Services, and other advocates for children. 73 young people came forward and were substantiated during that symposium that we did over a period of time. I bring that up because we used those outcomes to change a law, or to pass a law in the state of Indiana, having an hour of curriculum about child sexual abuse, prevention, internet safety, and phone safety. I bring this up because as we went through that exercise, hundreds of survivors came forward and talked about the importance of how it impacted child trauma, impacted their lives, the inability to work, the inability to turn to addiction or to alcohol. So I bring this up to tell you that the No More Secrets campaign that we put together helped to aim and better understand and report abuse that that a child may experience. And so I appreciate this opportunity to continue to be engaged in this issue. And by advocating today before the subcommittee, I'm thankful for the demonstration of the subcommittee's commitment to investing in research to eradicate child sexual abuse in recent fiscal years. And I respectfully encourage the subcommittee to appropriate $10 million to this vital program for fiscal year 2022. I thank you again, Chairwoman DeLauro, Ranking Member Cole, and all the members of the subcommittee and the subcommittee staff for your dedicated work for holding this hearing. I thank you and I yield back.
Thank you very, very much for what is a really powerful testimony. And as we noted before, that it's personal experiences in people's lives that on the one hand, and I guess tragically you saw the other side of that coin, Congressman, with I believe your sister-in-law, and you know, and how people cope with these. This is real tragic in a child's life, and what happens. But again, you know, and I've had the opportunity to meet your wife, but to take that experience and for the two of you, and to, you know, work with 12,000 students really is quite extraordinary. And you know, you in so many ways you save people's lives, you turn their lives around, and there isn't anything more important than any of us can do. So, and the whole issue of child sexual abuse is and my sense is, though I don't have any statistics, you know, at my fingertips, is during this period of time, this, you know, with COVID, and you know that we probably have seen the increase of that of that abuse, and we try to think about how we try to prevent it, but when we can't prevent it, how is it that we try to address the needs of these children? And you may have said, but 91% of child sexual abuse is perpetrated by someone the child or the child's family knows. That is what is so egregious about this issue. And I will just tell you that in 2020, the CDC did establish that new funding line. It was for $1 million. 2021, it's been $1.5 million. And what the CDC was looking to do is to research and evaluate the approaches to prevent adult perpetrated sexual child abuse. So the line item is there. Let us work together to see about how we might be able to increase the opportunity to be able to increase the scope of the effort, and bring bring solace to youngsters. What an unbelievable effect it has on their lives, and oftentimes their lives end in tragedy because of this experience. So, thank you for what you and your wife have done on your own to address this problem. But I know that we want to work with you to see how we can engage with the CDC and a federal response to increase the opportunity to bring these children to come to grips with what's happened to them, and to be able to move on. So thank you very, very much. I look forward to working with you. I know we both do. Congressman Cole. Tom, yeah, unmute.
Thank you. Thank you, Madam Chair. Although I usually perform better muted, many of my colleagues would say. But want to thank you very much for bringing this program forward. There's not much more tragic than a situation like this. I mentioned earlier, we had another tragic situation. We had a member bringing significant legislation, important requests to us out of the tragedy that he experienced. And obviously your family has experienced this and you're knowledgeable about it. And you clearly want to help a lot of people because we're talking about a national program, not something specific to your district or state. But I agree with the chair. I don't have any doubt what we've just gone through has exacerbated our problems in this area. We've got a lot of kids that frankly have not been able to be in school, and that's sometimes the most structured and friendly environment for them. Sometimes that's their haven, not their home, where sometimes they are subject to horrific cases of abuse. So we certainly look forward to working with you. I must say you probably do pretty well in this committee since your predecessor was one of our favorite fellow appropriators. I think I met you once briefly in the hall when you were running, and he was squiring you around. So he wasn't very interested in talking to Republicans at that point, though, Madam Chair, Pete, because he needed to get you to talk to people that could help you. So,
everyone can help me, Congressman. Everyone can help me.
And please, when you visit with him, he's got that year banishment. We don't get to see him much. I hope we get to see him after that. But please tell him how much we miss him on the committee in general, on defense approach, where I had the privilege of serving under him in particular. He's just a master appropriator and just was a really wonderful member of Congress. And the fact that, again, he was recommending you, and I guess in some sense maybe is perhaps a mentor, speaks well of you, and because he didn't make bad choices and he didn't pick bad people. He's just a really great member of Congress. But this is a great cause, and I look forward to working with you in the chair and seeing what we can do.
I will pass those kind words on to Congressman Visclosky and to both you, Chairman DeLauro, and to yourself. I'll just close with what I had learned from survivors is two things. They want to be believed, and they want to help prevent other people from going through it in the future. And with that, we have the ability to empower the CDC to put ourselves in that position and to help all survivors by advocating for prevention. So I thank you both very much.
Thank you.
That Congressman Mervan was our last witness, and I just want to would you like to make any closing remarks, Congressman Cole?
I regret that my rules duty, Madam Chair, kept me from being involved. I really love the member day.
Right.
And I think this is maybe the best attended one we've had, maybe because it's remote, I don't know, but at least the time I got to be here. And I think I just turned mine on, and my good friend from Minnesota, Jim Hagedorn, was just wrapping up his testimony, and I know what a difference it made to him. I don't know if he touched on this in his testimony or not, but you may remember he came in and testified before our committee with some representatives of the Mayo in his very first year. I happened to be talking to him, and he had these. I said, we have Member Day coming. You should bring. There were a couple of interns. I said, bring them down and make a pitch for Mayo. I mean, they're one of our most important national institutions. We do a lot of funding for them through NIH, and he did. And of course, then he later had cancer himself, and came back and mentioned to me over and over. He said, "Boy, I'm glad you got me interested in NIH and Mayo and what it meant." And now he's a very passionate advocate for NIH, even though he's not on this committee and doesn't deal with it directly on his committees, but he actually gets up in our conference and makes a pitch about this and about getting your cancer checkup on a regular basis. Now, blessed he is. And so these are the days when you find out from members what's moved them, what's touched them, what's informed them, what's brought them here to this committee. And I'll just say in closing, and I say this is a great deal of admiration for my friend, the chair. They can't find a more sympathetic advocate. I think one that is more compassionate and more feeling. And and listens very carefully to what each and every member has to say. You do it on our subcommittee, you do it on our entire committee, and we legislate that way. And it's just a great privilege for me to get to be your partner on this very special subcommittee, which I think does a lot of very good work for the American people.
Well, I thank you very, very much. I too share the really wonder of the day with members. You learned, oftentimes the institution just doesn't afford you enough of an opportunity to understand what motivates people, why they do, what they care about. And we all come to the institution, not for self-aggrandizement. We come here because there's a view that this is the institution where you can really effectuate change, where you can make a difference, where you can help to change people's lives. And whatever that individual motivation is, what a day like Member Day is, gets displayed in some way. And that is so critically important. And, I think it helps us, with what the public feels, as if we don't really come together, as often as we should. So, I believe that this is the subcommittee, that allows us to do that in some very profound ways because of the effect of each and every one of the programs that we engage with has some. It's not a technical issue. It's so personal, and it has so much to do with people's lives and the lives of their families. So I agree. I enjoy it, and I enjoy listening to members. And I might add, as I was listening to people speaking and thinking about what we do, I thought about how collaborative that we have been, and the issues where we have. That we have so much in common with thinking about what we should do on some of these things, and where our values lie in wanting to see the federal government engage in a way that makes that difference. So it's really such a pleasure for me as we think through some of these things. Some obviously, and you say it, I say it, that we don't agree on and we won't agree on. But for the most part, with where this subcommittee takes us, it is to one, mutual respect, but a mutuality that I think helps us to put the resources which are most needed in people's lives. So I thank you so much for the opportunity to work together on this and for today's hearing. So, and you had a long stretch at rules, so thank you for showing up. I appreciate it. And with that, I will call this hearing to adjournment. Thank you so much. Thank you. Bye-bye.